Hello everyone. Today, we're diving into the world of a medication called Somatropin, commonly known by its brand name, Genotropin. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Somatropin, often recognized by its brand name Genotropin, is a synthetic form of human growth hormone, HGH. It is primarily used to treat growth hormone deficiency in both children and adults. In children, it can help with growth failure due to various causes, including idiopathic short stature, Turner syndrome, Prader-Willi syndrome, chronic kidney disease, and being born small for gestational age with failure to catch up by age 2 to 4 years. In adults, genotropin is used to treat growth hormone deficiency that can result from pituitary disease, hypothalamic disease, surgery, radiation therapy, or trauma, and can also be used in adults who have been growth hormone deficient since childhood. Additionally, it may be prescribed for individuals with muscle wasting due to HIV or short bowel syndrome. By stimulating growth and cell reproduction, genotropin helps the body grow and maintain muscles, bones, and other tissues. Warnings: Somatropin comes with its set of precautions. It's not intended for use in individuals with active malignancy, and caution is advised in those with a history of cancer. Individuals with acute critical illness due to complications following open-heart surgery, abdominal surgery, multiple accidental trauma, or those with acute respiratory failure should not use genotropin. It is also not recommended for those with certain types of diabetic retinopathy or with Prader-Willi syndrome who are severely obese or have severe respiratory impairment. Before taking this medicine. Before starting Somatropin, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug. Given its wide range of effects, those with any past medical history, including cancer, diabetes, or kidney disease, should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of growth progress, blood sugar levels, and thyroid function is advised for those on genotropin. You should not take Somatropin if you have an active tumor, severe illness due to complications from surgery or injury, or if you have severe breathing problems. Additionally, individuals with Prader-Willi syndrome should be screened for upper airway obstruction, sleep apnea, or respiratory infections before starting treatment. Before starting the medication, inform your doctor if you have ever had cancer, diabetes, thyroid disorders, scoliosis, or if you have undergone any surgery, particularly brain surgery. It's also essential to let your healthcare provider know if you are on any other medications or have any other health conditions that might affect your treatment. Side effects: all medications can have side effects, and Somatropin is no exception. Some individuals might experience injection site reactions, such as redness, swelling, or pain. Common side effects include headache, muscle pain, joint stiffness, and swelling in the extremities due to fluid retention. There is a potential risk of developing insulin resistance and high blood sugar, hyperglycemia, so monitoring blood sugar levels is essential, especially for those with diabetes. Other serious side effects include increased intracranial pressure, hypothyroidism, and, rarely, pancreatitis. If you experience symptoms such as severe headache, vision changes, nausea, or vomiting, it's crucial to seek medical attention immediately. Genotropin can also cause a condition called slipped capital femoral epiphysis, which is a slippage of the growth plate in the hip joint. Symptoms include hip or knee pain and limping. If you notice these symptoms, contact your healthcare provider right away. Furthermore, individuals with Prader-Willi syndrome should be monitored for signs of respiratory problems and sleep apnea, as genotropin can exacerbate these conditions. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: Somatropin might interact with other medications, including insulin and other diabetes medications, glucocorticoids, and drugs metabolized by the liver. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Somatropin. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The dosage of genotropin varies based on the condition being treated, age, weight, and response to therapy. For children with growth failure, the dosage is typically based on weight and administered daily or several times a week. Adults with growth hormone deficiency usually start with a lower dose, which is gradually increased based on individual response and side effects. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid. While on Somatropin, it's advisable to follow your healthcare provider's instructions regarding diet and exercise. It's important to avoid activities that could lead to head injuries if you experience headaches or visual changes. Given the potential for blood sugar changes, it's wise to monitor blood sugar levels regularly and avoid high-sugar diets. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects. FAQ. Many wonder about the age restrictions for Somatropin. It is primarily prescribed for children and adults with specific growth hormone deficiencies. The safety and effectiveness of Genotropin in individuals younger than 2 years have not been well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Somatropin, commonly known as Genotropin. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.